Sa lahat ng naririto ngayon, sa ating esteemed speaker, mga kaibigan sa media, mga kapwa-kawani sa health sector, at sa lahat ng nakatutok sa atin ngayon. Mula sa kagawaran ng kalusugan, magandang umaga po. Ako po si Nikki Cesario, ang inyong kasama ngayong araw. Ayan, so ngayong umaga, atin pong makakasama si Dr. Imelda Muriel Mateo para po talakayin ngayong umaga ang Kapihan ng may karamdaman, COVID-19 boosters, additional doses for A3 or adults with comorbidities. So ayan, para po sa umagang ito, makakasama po natin si Dr. Imelda Muriel Mateo, President ng Philippine College of Physicians, Treasurer ng Philippine College of Physicians, and Medical Center Chief, Medical Specialist 3 ng Amang Rodriguez Memorial Medical Center. So ayan, bago po natin tawagin si Dr. Mateo, mag-stream po muna tayo ng video bago tayo tumungo sa kanyang presentation. Ayan, cue video po, play please.
When you breathe, air flows in through your mouth and nose and down your airways. Inside your lungs, the airways end in clusters of air-filled sacs. These air sacs are surrounded by tiny blood vessels. Here, oxygen from your lungs passes into your bloodstream to get to tissues throughout your body. Carbon dioxide is breathed out. COVID-19 is a disease caused by a virus called SARS-CoV-2. The virus infects cells along your airways by attaching to ACE2 and other molecules on those cells. The virus uses ACE2 as a door to get inside of the cells and make more copies of itself. The virus, and your immune system's reaction to it, inflammation, damages the air sacs, causing them to scar and stiffen or fill with fluid. This blocks some oxygen from passing from your lungs into your bloodstream. As blood oxygen levels fall, you may feel short of breath. In severe cases, a ventilator or other support may be needed. Inflammation helps our bodies fight infection, but in some people with COVID-19, it seems to go into overdrive. Researchers think this may be due to the fact that the virus latches on to the ACE2 molecule in order to get into cells. ACE2 helps reduce inflammation, and this effect is lost when the virus occupies it. The result is that inflammation can go awry. NHLBI-funded research.
Ayan, so paalala po muna sa ating mga media partners, maaari po kayong mag-chat sa ating chat box para po sa inyong mga katanungan. So ayan, hindi na po natin patatagalin pa, narito po si Dr. Mateo para po ibahagi sa atin kung ano-ano po ang mga benefits, para po talakayin ng COVID-19 boosters, additional doses for A3 population.
Morning. Salamat, Nikki, for the introduction. I hope that short video, animated video, helped, no? Nakatulong sa konting pagkaintindi kung ano ang effect ng COVID sa ating baga o sa ating lungs. No? So, nandito ako to share to you some of the benefits ng additional booster doses or additional doses of COVID-19 vaccines sa mga A3, no? Specifically A3 or the adults with comorbidities. So next slide please. Okay, just konting review lang. So ano ba yung group A3? Ito yung mga adults na may controlled comorbidities not included in the A1 category. Ibig sabihin, hindi na sila frontline workers in the health facilities and hindi rin sila senior citizens. Kasi nga, the age group specified is from 18 to 59 years old. Next. So, ano yung comorbidities? But let me reiterate, controlled comorbidities. Ibig sabihin, pag may active or in treatment, or nasa hospital because of these illnesses, hindi muna pwedeng bakunahan. So, the controlled comorbidities which qualify the A3 group are the following. So, wala silang symptoms, stable ang vital signs nila, they've had no attacks of their illness, wala silang admissions, or no changes in the medication for the past 3 months. And ito nga yung sinabi ko, they should not be hospitalized at the moment. No? Ano ba itong mga comorbidities sa respiratory system? These are chronic respiratory diseases. So, andyan yung mga COPD, uncontrolled asthma, okay, so bronchiectasis, chronic bronchitis, okay, pulmonary or emphysema, and some other organ systems are those with hypertension, cardiovascular disease or sa heart, chronic kidney disease or illness ng bato na matagal na at andyan na may complications na, cerebrovascular diseases, yung mga stroke, yung mga heart problems, no? Yung mga coronary artery diseases, cancer or malignancy, diabetes, obesity, those with liver diseases na pangmatagalan na, and neurologic diseases, and of course, tuberculosis and other chronic respiratory tract infections. So yung mga other, mga HIV in the lungs, so yung mga ganyan, no? Chronic na yan, pangmatagalan. And some immunodeficiency state, no? So yung mga specific comorbidities sa lungs are the following, or the respiratory systems: asthma and respiratory allergies. Okay, pwedeng upper or lower allergies, no? Then COPD or the chronic obstructive pulmonary disease, and if you want to categorize them, the chronic bronchitic patients and the emphysematous patients. Bronchiectasis, ito yon na akala lagi, no? Kasi ang usual presentation nito is hemoptysis or yung coughing out of blood. And most of the patients would mistake this for TB kasi may blood, no? Kala nila TB lang ang nagbibigay ng spitting out or coughing out of blood. Pero actually mas common yung bronchiectasis. We have the interstitial lung diseases or yung mga sakit sa baga na hindi yung daanan ng hangin ang affected, kundi yung mga parenchyma, no? Yung supporting structure of the lungs ang affected. Interstitial lung disease, that means part of the lungs other than the airways. And we have pulmonary hypertension, yung mga vascular or blood vessels affecting or going to the lungs or near the lungs or directly going in or out of the lungs, no? Then lung malignancies, ito nga yung mga cancer of the lungs. Pulmonary tuberculosis, histoplasmosis is an infection caused by parasite Histoplasma strongyloides, I think, no? That causes damage sa lungs. And I included smoking or nicotine dependence. Bakit nyo sasabihin, disease na ba yung smoking? Yes po, it's already classified, no, in the International Classification of Diseases as a disease itself, no? In other terms, pwedeng sabihin nicotine dependent. So that means these chronic respiratory diseases will make you more immunocompromised. Okay, next slide. So for other cardiovascular diseases, hypertension, coronary heart disease, ito yung merong yung atherosclerosis or bara sa mga blood vessels going to the heart. Ito yung mga ischemic heart disease, yung mga dating history ng heart attack, yan yun, no? And then cardiomyopathies are those affecting the muscles of the lungs, mostly yung mga enlarged hearts, no? Pwedeng related din yan sometimes sa other diseases, post-infection cardiomyopathies or post-pregnancy cardiomyopathies. And peripheral artery disease, so yung mga blood vessels o yung mga ugat na nababarahan with atherosclerosis, no? Kasama na rin yung aortic diseases, no? Rheumatic heart disease, galing yan sa infection na nagkaroon ng problem sa valve of the heart, no? And congenital heart diseases, katulad ng mga tetralogy of Fallot, no? Yung mga blue baby, no? Mga congenital problems sa valve of the heart, no? Now, on birth, present na. Okay, next. Of course, chronic kidney disease, in those undergoing dialysis, yung mga may end-stage renal disease, yung merong mga glomerulosclerosis, nephrotic syndrome, mostly sa bata, nagsisimula pa lang, no? And cerebrovascular disease such as stroke and transient ischemic attack. Of course, ito nga mga cancers, and diabetes, whether type 1 and type 2, and obesity. Okay, these are the risk factors or those comorbidities that are considered in the A3 group. So chronic liver disease, those with hepatitis, with cirrhosis, and non-alcoholic fatty liver disease. So yung most discussed na cirrhosis sa atin kasi is alcohol intake. Pero marami na ngayon na not even due to alcohol intake, may fatty liver sila. Mostly siguro sa diet natin, sa lifestyle, at saka sa mga pwedeng can be caused occasionally sa mga gamot na ininom natin. No? And neurologic diseases or diseases of the central nervous system, such as dementia, Alzheimer's, Parkinson's, epilepsy, seizure disorders, Bell's palsy, Guillain-Barré syndrome, and spinal cord injury. Okay. The specific immunodeficiency state, some of them are those related to genetics, no, the primary immunodeficiencies, or can be acquired or secondary, such as, or example is the chronic use of steroids. HIV is also an immunocompromising state, no, and those who have had organ or blood transplantation are considered an immunocompromised patients. Other diseases in the blood, mostly thalassemia and Down syndrome, can be considered as the comorbidities for A3 category group. So, even without COVID, and this would render them having a severe level or stage of COVID-19. Interruption. Okay. Are we back? Okay.
Doc, ayan po. Nag-chop po kayo kanina. Hello? Paumanhin po sa ating mga media partners at sa lahat po ng nanonood ngayon. Nagkakaroon lang po yata ng slight internet problem si Doc Mateo. Doc?
Yeah, I think I got interrupted. I'm sorry. I got disconnected. Can you hear me now?
Yes po, very clear na po now.
Sorry about that. Okay. So you heard me, no? Why is it important for these A3 people to really receive the vaccination? Kasi we want them protected for the severe form of COVID-19. Okay, so next slide. So what we have, of course, the first 2 doses, and we have started this since last year. In fact, early last year pa, no? So, but I think maraming Pilipino pa rin may apprehensions at may worries kung kailangan ba nila talaga yung vaccine. I have reiterated the need to protect them from the COVID-19 infection to prevent the critical or the severe or critical form of the illness. Kasi nga, immunocompromised na sila or they have comorbidities. Kahit na controlled yung comorbidities nila, they are still rendered prone or at risk for developing the moderate to critical stages of COVID-19. Now, so they came a time that after the first season of vaccination drive natin, no? So, sorry, can you go back to that slide? So, and then we found out that, and science found out, no, that nag-wane yung yung protection natin, no, yung immunity with the vaccine over a period, and that's, I think, beyond 6 months, bumababa na yung antibodies natin, no, to fight the COVID-19. Especially, we don't want to put this A3 at higher risk of getting the severe to critical. So, nag-recommend na ang WHO, and of course, in-adopt na rin natin in other countries, of the role of additional mRNA doses, or at least the role of other third dose of the vaccines, whether in what platform, no? So, but here I will present to you ano nga ba yung critical roles ng additional mRNA, no? specifically, kasi ito yung may mga studies o clinical trials na nakita sila. So let's go back. Let's go to the next slide. So ito yun. This is with permission from Dr. Jean Solante, who's member of the vaccine expert panel. The following are his slides generously shared to me, and with permission, i-share ko rin sa inyo. So nakita nila in the different studies that may critical role talaga yung additional mRNA doses. Ano ba yung mRNA doses? These are the platform used by Pfizer, by Moderna. Now this is the one different from the Sinovac, which is yung attenuated virus organism, no? Ito yung buong organism na inactivated, pero ito alam naman natin kung ano yung platform ng Moderna and Pfizer. Okay? So ito yung may specific study. I'm not saying walang role yung iba, but since ito lang yung merong pinakitang study, so anong naging resulta? They found out that with a surge of Omicron, or nag-mutate na yung virus, naging Omicron variant na siya, nagkaroon na ng undetectable neutralization, even those who were vaccinated by the 2 doses. So what they did, nagkaroon ng individual booster doses with mRNA vaccines, and then they saw that they had potent neutralization even of the Omicron, although it was only 4 to 6-fold that of the wild type. Ibig sabihin, tumaas nga yung antibodies to a neutralization power, although not too high, kasi 4 to 6-fold lang. Kasi dati, yung first 2 doses, you can reach as high as 10-fold, no? Mataas talaga yung antibodies. But they say that it really had an added benefit. And they also had cross-reactivity sa neutralizing antibody doon sa Omicron variant. No? So Omicron pseudovirus is more efficient, although in infecting that other variants tested, but it protects you from the severe or the critical stage or type of the infection. So next slide. Next slide, please. All right. So do not focus on this busy graph, no? Focus on the ones I highlighted with blue color. Okay. So ano to? They also looked into the role of these mRNA vaccines, kahit na ang initial 2 doses are those of AstraZeneca, no, as the primary series. So those who received 2 doses of AstraZeneca they found out had no effect against Omicron beyond 20 weeks after the second dose. But when they gave the booster with mRNA platform, the vaccine effectiveness ranged from around 65 to 75%, even for Omicron. Okay, so although through time, let's say from 5 to 9 weeks and 10 weeks onwards, nag-drop yung effectiveness. But just the same, starting from 0 effectiveness dun sa Omicron, tumaas talaga because of the third vaccine or a booster with the platform of mRNA. Okay, so definitely this shows that merong talagang important role ang booster doses with an mRNA vaccine. So next slide. Okay, ito naman another type of role of the mRNA over type of primary vaccine series. Now, BNT, this I think is Pfizer din, no? Ito yon. So, among those who received the 2 doses of Pfizer or Moderna, ito yung kahit na mRNA ang platform ng vaccine na ginamit sa primary series na 2 doses, bumaba pa rin to 10% by 20 weeks after the second dose, no? Unlike the AstraZeneca, talagang halos 0 na beyond 20 weeks from the second dose, ito may natitira pang 10%. Pero beyond 20 weeks, talagang bagsak ang effectiveness ng vaccine, the primary series. So after 2 to 4 weeks, the third dose, they found out that the vaccine effectiveness ranged from around 65 to 75%, although over time, beyond 10 weeks, bumaba na siya hanggang 40 to 50%. No? This is of the infection, but the protection against severe to critical is still high, no? Is almost maintained during the 4 weeks beyond the third dose or the booster dose. No? So if we're talking about infection, no? The infectivity or immunogenicity with even the mild form, pero yung critical and severe, ano yan, mataas pa rin ang protection. Okay, next slide. Okay, so they were able to show that there is reduced risk of hospitalization of Omicron versus Delta with the 3 doses of vaccine. Alam natin yung first, I think the second surge natin, Delta yun eh, and then we saw a lot of severe critical patients. In fact, na-overwhelm ang hospital utilization because most of the cases that we encounter are of the severe to critical cases needing hospitalizations. But some of these patients, kahit na wala pang third dose during that time, they needed hospitalizations but not as severe, no? Kasi nga, meron na silang initial protection. Pero when the vaccine period beyond the second dose went beyond 20 weeks, those who got infected ay nagkakaroon na rin ng moderate to severe to critical. No? So they were able to show with published analysis that the estimates that Omicron cases versus Delta show that ang severity is really leaning towards Delta. Mas infectious, high infectivity rate ang Omicron, highly infectious, ang bilis makahawa, ang bilis kumalat. Pero yung risk of hospitalization was only 1/3 of that of Delta. No? So, ibig sabihin, those who were severely, were majority infected with Omicron during this, I think, third surge na natin ito, no? Nung Omicron sobrang taas, which started sometime after, kailan ito nagsimula? Nitong ano na, no? December, January, di ba? Nakita natin sudden surge. Tumaas na naman, no? In fact, the numbers are almost doubling or tripling, okay? So, ang nakita nila, yes, marami infection or marami infected, pero ang severity is not as that what we saw for Delta. Yun nga, 1/3 lang ng Delta. And the risk of presentation to emergency care or hospital admission with Omicron is only half of that for Delta. So, ang Delta, ang presentation, clinical presentation, respiratory involvement is more severe than Omicron. No? And the risk of hospitalization is lower for Omicron cases after 2 and 3 doses of vaccine. So, yung pangatlong vaccine natin, or the booster dose, or the third dose, if you're using the same platform, is higher pa rin for Omicron cases if you talk about hospitalization. Also, there is 81% reduction in the risk of hospitalization after the 3 doses compared to unvaccinated Omicron cases. So, yung third doses natin, which were given to us mostly during November and December, rendered us protected from hospitalization kahit na-infect tayo ng Omicron. Kaya most of the cases or most of the patients of the Filipinos who got infected with Omicron were able to manage even on home isolation, not needing hospital care anymore, but of course, with continuous monitoring. Okay, so next. Okay, so neutralization is just, it's too busy a slide. Just the message is the variant of the neutralization of the Omicron variant is significantly reduced. And so there is the importance of a booster dose to retain the protection. So yung neutralization with the previous 2 series of vaccine bumaba. No? Napakita na natin yan in the previous slides. Kaya the role of a booster dose is really very important because we want to maintain this protection against the severity or at least some percent for the infection itself. So if you look at the highlighted vaccines here, okay, so the primary immunization, ibig sabihin yung first 2 doses, provided no limited protection against the symptomatic diseases. Pwede you can be symptomatic but severity-wise, more of the mild pa rin, no? And the role of boosting with the mRNA will render increased protection. So yun yung take-home message dito. And the mRNA booster immunization will also elicit potent neutralizing serum activity against the SARS-CoV-2 Omicron variant. Although in the first 2 doses, there is a near complete lack or absence of neutralizing activity, the mRNA booster immunizations rendered significant increase of the serum neutralizing activity. So tataas na yung level mo sa antibody and neutralizing activity or power because you have been boosted with a third dose, which is the mRNA vaccine. Okay, so they were able to show in different meta-analyses or studies now that shows early result to predict vaccine efficacy against Omicron. So, and this I think I have mentioned in the previous slides. No, it traced the efficacy against severe disease by 98.2% and against symptomatic to 86%. No, so bumaba na yung mRNA vaccine protection in the first 2 doses to 40%. But because of the booster dose, tumaas siya sa 86.2 for the mild symptomatic. But for the severe disease, the booster dose rendered 98.2 protection. Okay? All right, so that stressed the importance of the third dose or the first booster dose. No? So, ang take-home message is neutralization titer for Omicron were boosted 2.7-fold and 34.2-fold following the third dose of the mRNA platform vaccine. Okay, and these titers, while they fell or they went below in the 28 days and 6 months following the second dose, na boost nila into 2.7 to 34.2-fold. Okay. Next slide. Now, what about the fourth dose or the second booster dose? Because they found out by clinical studies or by studies that even with a booster dose, the neutralization power also decreases beyond 3 to 4 months after the booster dose. And that is why they proposed already or they are suggesting, and even I think WHO is acknowledging this already, although it's not been recommended internationally. They were able to show some data that the fourth dose or the second booster dose, why are we saying fourth dose? Fourth dose if you're using the same platform. If you started with the first 2 series with mRNA platform, a third dose is the first booster dose is your third dose and the second booster dose is your fourth dose versus a second booster dose. Booster dose for those whose platform used in the first 2 series are not the mRNA. For example, Sinovac, AstraZeneca. I'm not sure about Pfizer. No, Janssen kasi 1 dose lang yan. So the second booster dose nila, the first booster dose nila is the one given between November and December. And then if they're going to get a second booster dose, that means second of the different platform used in the first initial booster. No? So para mas malinaw, for example, Sinovac, first 2 doses using a different platform. First booster nila is using mRNA platform or either Pfizer or Moderna. No? And then kung may fourth dose na, for those dire-diretso, consistent all Pfizer, all Moderna or mRNA, sa atin, like me, I got 2 series for my vaccines using Sinovac. And my first booster dose was mRNA. That means I qualify for the second booster dose, which is using mRNA pa rin. Okay, so just setting the data or the information clearly. Okay, so next slide. So these are just the countries that started giving or are considering the fourth dose of COVID-19 vaccine, because most of these countries use the similar platform, no, from the start. Kaya fourth dose na nila yung second booster natin. Okay, next. And some countries are, for example, Israel. In February 2022, they reached the 75% of their population of 9.5 million receiving the 1 dose. And in sometime before February, 4.4 million already received the third dose kasi they're using the same platform of vaccine, so third dose. But they started vaccinating the 60 years old and older and those who are immunocompromised and medical workers who are frontline and with direct contact with COVID patients. And they were able to receive, to give to 550,000 already of the fourth dose. While in Chile, this started in January 10, 2022. They're already administering the fourth vaccine shots, also with immunocompromised residents. And they're trying to roll out to everyone aged 55 and older. So sa kanila, ang senior citizens, I think, are 655 and older. Pero may qualifier. They should have at least 6 months past their initial booster starting February 7. So sa February 7, and I think they're doing this already, nag-vaccinate na sila ng fourth dose nila. Okay? Cambodia, Denmark, and Sweden are planning to offer the fourth dose to specific groups. So may qualifiers, very specific yung kanilang population. They want to give the fourth dose. Okay? Next slide. So last January, even the US recommended care of the Center for Disease Control that they will give the immunocompromised eligible citizens with a fourth dose. No? These are those patients who are receiving cancer treatment, received an organ transplant, people with HIV, people have autoimmune disorders, or are taking medications that can suppress their immune system. So tingnan nyo, this group of patients are our A3 patients. No? Consistent yan, tingnan mo. Those with cancer treatment or history of cancer, organ transplant, immunocompromising state. No? Although dito, di pa nila sinulat yung senior citizen. No? Pero kung tutingnan nyo, pasok ito lahat sa A3 group natin. And across the UK, a second booster dose will be offered to, sa kanila, ang senior citizen starts at 75, or the age requirement is above 75 and above years old, those in home care, and people aged 12 and over with weakened immune system. So pasok pa rin sa A3 except the age, no? Age limit. Sa atin, 18 to 59 ang A3. Okay, next slide. Next slide, please. Okay, so next slide, we're here. So the general findings, according to the different prints and small studies, after the third vaccine, this is just summarizing it, no? After the third vaccine dose, the participants' antibodies, these are the findings they were able to come up with after the different small trials, no? The participants' antibodies can block Omicron from infecting the cells, but not as well as they block the Delta variants. No? After the fourth dose, the antibodies potency against Omicron rose, but also not more than their potency against Delta. Ibig sabihin, yung potency ng vaccine with the first surge natin, yung Delta variant, halos equal din sa power nila, sa strength nila to counter the Omicron variant. No? The vaccine, which was very effective against the previous strains, is less effective against the Omicron. So even the fourth dose was shown to have only partial effectiveness in protecting against the Omicron stage. They're saying protecting the infection. They're not saying that protecting against the severe. So wala pang dito, but we were able to show that, diba, tumaas pa rin yung protection against severity to almost 94.8%, right? And a 4-dose course of Pfizer vaccine was 30% more protective against infection than a 3-dose course. Compared to Moderna, also, although they are of the same platform, yung efficacy of the 4th dose medyo lower than the Pfizer vaccine. No? So the relatively small increase in efficacy between the 3rd and 4th doses may be attributed to the fact that protection offered by the 3 doses is already quite high. No? Mataas na rin siya. Pero kung sa may immunocompromised, we need the small percent increase of protection kasi immunocompromised ka nga. Kaya importante pa rin yung 4th dose. Okay? So the small additional protection could be useful for high-risk group during a surge. So ito yon. So we want to be protected and let us prepare for another surge because yung mga nearby countries natin tumataas na naman ng number of cases nila, no? Even in Hong Kong, there's been shown na ang taas na naman yung kanilang cases. So, ang lapit na natin. So, we want to be protected with, and hopefully not, no? With another surge by a 4th dose. Okay? So, next slide. And so, with permission from the vaccine expert panel, with, and of course, from Dr. Jean Solante, a member of the vaccine expert panel, they recommended the 4th dose or the second booster dose. So 4th dose is if you're using the same platform, and the second booster, if your first 2 series is different from the mRNA. So the small added protection provided by a 4th dose or a second booster dose may be useful. May be useful for special populations such as the moderately and severely immunocompromised. When you say moderately immunocompromised, those are the subgroup Ibig sabihin, kung talagang immunocompromised severely, we might be able to recommend them earlier than those. Kasi you'd see here in the next recommendation of vaccine expert panel that the 4th dose may also be given to individuals most vulnerable to the severe form of COVID-19, like the elderly, those with comorbidities, those who have high risk of exposure, so the healthcare workers, the frontliners, the airport personnel, kasi dyan ang gagaling yung mga travelers from other highly, countries with high cases already, and the like. So the interval that they recommend between the 3rd and 4th dose should be at least 4 months. No? 4 months dito, pero by the physician's assessment, kung severely immunocompromised, you can give the 4th dose or the second booster as early as after the 3rd month. Okay? All right. So I think that's my last slide. Okay, so I guess we can open our discussion for question and answer or the open forum.
Ayan. So maraming salamat po, Doc Mateo, sa napaka-extensive na pagtalakay sa atin ng role at benefits ng COVID-19 boosters for the A3 population. Gayon din sa kasalukuyang sitwasyon ng pagtuturok nito sa iba pang mga bansa. So kaya ayan po, hinihikayat po natin ang lahat na magpabakuna na ng kanilang mga booster shots dahil tuloy-tuloy po ang ating Bayanihan Bakunahan Program 4 hanggang Biyernes. So ayan po, tumungo na po tayo sa Q&A portion with Doc Mateo. So amin po munang tatanungin ang mga nagpadala ng kanilang question in advance at susunod po nating babasahin ang ating mga live questions. So Doc Mateo, ito po ang first question ng media para po sa inyo. Mula kay Caroline Bongkin ng CNN. Doc Mateo, would you have an idea on how soon will senior citizens and persons with comorbidity need a second booster? And are you already seeing a breakthrough infection among A3 group who did not get booster shots?
Okay. So far, when we say breakthrough, infection or severe disease, kasi we see actually ang nakikita namin are those with unvaccinated. So, kung isi-share ko yung experience namin sa hospitals, especially here in NCR, meron pa rin talagang mataas population getting the moderate to severe, pero yung dumadami ang asymptomatic, so hindi namin nakikita yung data on that kasi they go on home isolation, in fact untreated, they don't even need, most of them don't consult anymore kasi very mild. Pero sa hospital, yes, we see still a lot of moderate cases na kailangan hospitalize kahit na nag-vaccinate sila ng first 2, So we see 3rd dose. After the 3rd dose, bihira yung nakikita naming na-hospitalize. If ever may consult, those that can be managed as outpatient or on home isolation. In fact, even sa mga healthcare workers namin, tumaas yung infection after most of them have been given the third for Pfizer, 3rd for mRNA, the first booster dose, kung nabigyan namin sila, nagkaroon pa rin ng infection. This was during the Omicron surge. Ang dami. Dumami to almost like 200 plus. Anong ibig sabihin? Kahit na nag-booster dose, and because of the variant, the type of virus, na-infect pa rin sila. But very mild, and most of them asymptomatic. So I hope that answered the question. Did I answer it? Meron pa bang part of the question na hindi ko na-address?
Okay na po, Doc Mateo. So ayan, maraming salamat po sa pagsagot no ng ating question from Caroline Bongkin. So para po sa ating next question, however, maybe this question is better referred to VEP po, but if Doc Mateo would like to add or give a comment on this, do we see po ba continuous longer protection from hospitalization for severe COVID even if nagwe-wane ng effectivity ng third booster shot, ng third dose?
Yes. Definitely. Kasi alam natin na kahit na nai-infect ka with Omicron, even after the third shot or the first booster dose, nakita niyo naman, mild kasi yung Omicron, no? It's highly infective, but compared to what I have shown earlier, compared to the Delta, ang severity niya is less than Delta. So would not really needing hospitalization. And yes, we see cases na kahit na hospitalized, ang effect sa lungs, no, less. In fact, meron kaming nakita even after the first 2 series, may mga cases na just because they're vaccinated, ang effect sa lungs even by CT scan or by chest x-ray lesser than those who were unvaccinated. So talagang critical ang role ng vaccines, no, sa severity of the illness. Okay?
Ayan, thank you po, Doc Mateo. So another question po from Red Mendoza ng Manila Times. Again, I think this would be better referred to VEP, but again, if Doc Mateo would like to answer and give a comment po. Hi, Doc. Would the 4th dose ng COVID vaccine be applicable sa mga taong may comorbidity aside from persons with immunodeficiencies, which is given needed nila ang 4th dose as per WHO recommendation?
Yes. In fact, Tricia, A3 has comorbidities, di ba? A3, hindi naman sinabing active dapat yung comorbidity. In fact, pasok na pasok sila doon sa qualifier. Ang WHO, inuna lang daw severely immunocompromised, but you would see those with comorbidities, pwede nang bigyan. Pero, yun yung recommendation, and that's a practice being done by other countries, yung Chile, Israel, di ba? So, nakita natin kanina, and saka sa, I think, UK, no? So, even yung mga comorbidities, pasok na as a qualifier or sa criterion for getting the 4th dose or the 2nd booster. Eventually, I think this of course will depend. Ayoko i-preempt ang vaccine expert panel, ang DOH and the IATF and the vaccine council, no? Yung National Vaccine Organizing Council. Ayaw nating i-preempt yan, but definitely I'm sure they will look into that. Especially kung meron naman tayong enough supply of vaccines na pwede nang ibigay over and beyond those na hindi pa nakakakuha ng primary series of the vaccine. Let's wait for it. Tama ka, Trish. Hindi ko pwedeng i-preempt, no, yung decision nila. But let's wait. But I see some positive decision nila kasi even the vaccine expert panel has presented their recommendation. Pero it has to be adapted still for national implementation.
And thank you po for answering that question po, Doc Mateo. I think nakapagbigay naman po kayo ng answer kay Red ng Manila Times. So ito po for our next question from Caroline Bongkin ng CNN. Doc, may nakikita po bang difference sa damage ng COVID sa lungs ng vaccinated versus unvaccinated versus boosted people po?
Yes, nabanggit ko na, di ba? There are patients na makikita mo ang severity or extent of involvement sa lungs by CT scan and by chest x-ray. Yes, we definitely see. So that means nakikita namin even the severity of the illness itself, not only sa lungs, no? Mas maraming moderate and less severe and mildly symptomatic sa patients who are vaccinated versus unvaccinated. Okay? So what about for boosted? Yes, we still see that. In fact, we don't even see changes in the lungs anymore. Mildly symptomatic na lang sila, parang upper respiratory tract infection na lang, na parang ordinary sipon or viral infection that we have na seasonal. Ganun yung nakikita naming presentation. Very seldom that we see na booster dose na sila na talagang naging critical or moderate, critical and severe. If ever, it is because of the active comorbidities nila. It is because the uncontrolled yung other illnesses nila that render them very prone to have severe to critical form of COVID-19. Okay?
Thank you po, Doc Mateo. So ayan, paalala po sa ating mga media partners, we are down na po sa ating last 2 questions dahil limited lamang po ang ating oras para ngayong araw na ito. Ayan, so para po sa ating second to the last question po, Doc Mateo, mula po kay Kathleen De Villa ng Philippine Daily Inquirer. Hi, Dr. Imelda. Are there existing studies on the link between developing lung disease after contracting COVID-19? Kindly explain po the level of risk of developing lung diseases after getting COVID. Thank you po. Doc, naka-mute po yata.
Sorry. Yes, definitely meron. That's why we have the term sa pulmonary medicine, yung long haul, no, or the long-term COVID sequelae. Nakikita namin na even especially those who had the severe form and critical form na nag-survive, nakikita namin yung long-term sequelae sa lungs, no. Nagkakaroon sila ng shortness of breath, nagkakaroon sila ng chronic cough, no, chronic sputum production. So, and we call this, initially we call it the COVID long haul, no, na meron pa rin sequelae na talagang merong long-term effects sa lungs and damage. So that means when you have more coughing, when you have more shortness of breath, may mga structures sa airways that were really damaged, no. Kung nag-recover man, nagkakaroon din sila ng residual abnormality sa airways, no. Now, much more siguro sa unvaccinated. So kasi nga, yung unvaccinated had more severe illness, no, and mas critical sila. So versus those who were vaccinated. Kaya lang yung vaccinated pero inactive yung comorbidity nila, pwedeng halos kapareho na sila nila ng unvaccinated na na-infect pero wala namang comorbidity, no. So in other words, it really depends on the coexisting illnesses of the patient. For example, COPD patient ka na, alam nating may damage siya sa lungs mo. Smoker ka na, so alam nating yung mga cilia over your airway damage na because of the nicotine and other chemicals brought by cigarette. Meron ng damage yan, dadagdagan ko ba naging long-term damage of the COVID illness. So yes, definitely merong lung damage and existing sequelae or the long haul effect of COVID. Okay?
Thank you po, Doc Mateo, for that. And ayan po, no, bilang mas high nga ang risk ng ating mga may comorbidities na unvaccinated. So ayan po, naway maging mensahe ito para magpabakuna na po ang karamihan sa ating lahat. Ayan, so bilang ang follow-up question po, Doc, sa tanong pong iyon, mula po kay Caroline Bongkin ng CNN, to clarify po, ibig sabihin po ba mas long-term po ang lung damage ng unvaccinated?
Yes, kasi nga yung severity, no, pag unvaccinated ka, mas malawak kaysa those with vaccinated. But yun nga, kinlarify ko din, hindi naman necessarily dahil unvaccinated ka, ang damage sa iyo ay greater than those vaccinated who had severe disease. Ang pinag-uusapan is the severity of the illness that you contracted, no? Kasi kung vaccinated ka nga, pero active and uncontrolled naman yung comorbidities mo, baka ang effect sa long term ng COVID will almost be comparable to those who were unvaccinated pero wala namang comorbidity. So nakita niyo yung other factors that play here, no? The comorbidities, it has to be controlled, and vaccination is very important because that renders you the milder form or at least not the severe or critical form of the illness. Okay?
Ayan, so maraming salamat po, Doc Mateo, for providing the answers regarding po sa benefits and role ng booster shots sa ating comorbidity population, sa ating population may comorbidity. So, paumanhin po sa ating media partners at yun na po ang huling tanong na ating matatanggap pong sagutin ngayong araw na ito bilang, again, limitado nga lang po ang oras natin para sa ating kapihan today. Ayan, so napakabuluhan ng ating naging kapihan ngayong araw. At bago po tayo magtapos, muli tinatawagan po natin si Doc Mateo para sa kanyang mga pabaong mensahe bago po tayo tuluyang mananghalian.
Okay, so importante, get vaccinated, no? In fact, lalo na for those, kasi may certain percent pa ng population, kahit yung primary series, hindi pa nagpapabakuna. And we still see a lot of those, no? So pag vaccinated na kayo, I hope by this time nakuha nyo na yung first booster shot nyo. So kung hindi pa, get them. Kasi baka mamaya lumabas na yung advisory na pwede na tayo sa second booster or sa fourth dose, hindi pa kayo nakaka-third dose. No? So please get them. Definitely, it will render you some high protection against the severe form of the disease. No? Just like an ordinary vaccine like flu vaccine or pneumonia vaccine, hindi naman natin sinasabing hindi ka mai-infect. But ang piniprevent natin are the severe form of the disease and the hospitalizations. Okay? Get vaccinated aside from having your comorbidities controlled, and consult your doctor, make sure you take your proper medication, okay, and stay healthy. And of course, please still practice the minimum health standards. No? Okay? So wear your mask, optional na yung face shield, and then keep your distance. No? Okay, wash your hands, disinfect your hands very often, disinfect them, wash with soap and water available, and good air ventilation and protection. Stay healthy, maintain your comorbidities under control. And last message, get vaccinated. Okay? Thank you.
Ayan, muli maraming salamat po Doc Mateo ngayong araw at talaga nakapag-provide po kayo ng sapat na impormasyon tungkol sa ating paksa ngayong araw. So ayan, bilang narinig nyo naman po ang mga paalala ni Doc Mateo, muli para sa ating mga kababayan, patuloy po nating sundin ang ating minimum public health standards at magpabakuna na po tayo lalo higit na extended ang ating Bayanihan Bakunahan Program 4 hanggang Biyernes, March 18. Ang laban po natin sa COVID-19 ay mas kaya kapag may bakuna. Muli mula sa Kagawaran ng Kalusugan, ako po si Nikki Nesario at magkita-kita po tayong muli sa susunod na Kapihan with Media. Maraming salamat po at ingat po tayong lahat.
Thank you. Thank you, Nikki. Maraming salamat.